Thank you, chairpersons, for the kind introduction. At the outset, I'd like to thank Team Diabetica 2025 for inviting me, and Dr. Pratap Jetwani and Dr. Akash Singh in particular. So, my talk is managing type 1 diabetes in low resource setting and Indian perspective. Managing type 1 diabetes, not only in Indian setting, but almost across the world, is definitely a huge challenge. And there are a lot of considering the fact that the socio-economic consideration and the healthcare infrastructure disparities can lead to huge problem in managing these group of patients. So let us see what can be the reasons behind not managing well, and then what are the strategies which we can overcome these challenges. So the agenda of my talk is, let's look into the overview of type 1 diabetes in India, the key challenges in the low resource settings. The mental health and support system is so very important, community-based and government strategies, leveraging technology and innovation, and public-private participation, which could be a solution, and also the governance behind it. So if you look at the growing burden of type 1 diabetes in India, we know in IDF, probably the type 1 diabetes is supposed to be, in India, is second highest globally. And the incidence rate is about 3.6 cases per 1 lakh children annually. Now you just consider that with the huge population which India has, that proves that it is the highest burden of pediatric TIDM, which will definitely have whole lot of impact, not only the population per se, but along with the healthcare providers and the family support system, which goes into managing type 1 diabetes for these patients. So many patients definitely struggle to access the minimum necessities which is essential for type 1 diabetes. So rural areas, they are the one which faces the burden much more. The problem is much more in rural areas, and that can lead to much disparity in those population. So if you look into the disparity between the healthcare infrastructure as far as urban rural area is concerned, urban facilities are much better off than the rural facilities. The major impact could be the specialist access and the uninterrupted supplies to the rural population. So a significant disparity do exist between these two settings in India. And we are more concerned about the women population, because women and girls with type 1 diabetes often face additional discrimination, and the social stigma is huge with this group of population. So that is again an area of concern which was highlighted by Mohan and Mishra in 2020. Now, just look into rural area doesn't mean that it has to be low income group. Across the low income group, what we see, they struggle to afford the continuous diabetes management, leading to high rates of preventable complications. And as I said, the cultural stigma and lack of awareness often results in delays in diagnosis and poor adherence to the treatment regimen. Along with that, what we face is the social, economic, cultural diversity which we have, and that can lead to many communities maintaining traditional beliefs about diabetic causation, and that could be a conflict with the medical understanding. So again, that can lead to poor outcomes. So that is another area of concern. So proper education need to be incorporated in a management tool for these group of patients, and not only to the patient, because they are small enough to understand, but the healthcare provider and particularly the family, which need to be educated as well, along with the school atmosphere, where we have trained. We should have trained teachers to look into the various aspects of type 1 diabetes and its complications. So what does that lead to actually? That leads to a huge kind of problem at every level of management of type 1 diabetes. It particularly has a huge concern on the mental health support, which is often neglected, be it as the diagnostic phase or when you're trying to align the treatment, when you try to improve on the treatment, add on to the treatment, and then ultimately transition to self-care. Whenever there is a transition to self-care, that is a huge kind of distress associated with in this group of population. Along with that, what we have is the academic impact which it might have. So you will have a lot of social school absences and concentration issues which can definitely affect the educational performances and future opportunities. So one need to have a good mental health support, and that is often neglected in our Indian healthcare system. So a structured counseling program should be planned out, structured out, and it should be imparted to each patient along with the concerned assists. Psychological intervention are rarely integrated in standard diabetes care protocols. So from what we understand that has to be incorporated in our management plans for this group of patients. So in spite of knowing very well that just giving psychological support can improve the treatment, knowing that for decades, we are unable to integrate psychological support in our management tool. So what other problems remains? Obviously, the healthcare infrastructure gaps remains. We talked about the rural-urban divide, but even without being purely that divide, you might have the similar kind of infrastructure gaps, both group of population, whether it's urban population or the rural population. So there could be a storage facility problems. There could be the problem with this associated with specialty availability who can actually educate the patient and give the proper kind of inputs as far as management is concerned. Laboratory services one might be having limited access to laboratory services. So monitoring could be a major concern. And then if a patient lands up in emergency, whether the facility for emergency care is there or not, that is also of importance. So infrastructure gaps in Indian healthcare system pose significant challenges for type 1 diabetes management, and the basic stuffs are lacking in most of the places where they are being managed. So we need to think of something innovative, something much more than what we usually conventional treatment we plan out or conventional protocol which we set in order to address all these issues, which I am going to talk to you all about. And then again, major issue which is insulin access challenges, low resource setting. This is not only a area of concern now in rural area, but also in the urban population. A little bit away from the major tier 1, tier 2 city, you'll find about 20-30 kilometers away from the center of the city, you will have this major problem, that is accessibility to insulin. So there could be supply chain disruptions, there could be storage challenges, and then limited monitoring tools. So how do we address it with such a big population? So we have to come out with some kind of strategies. We have to take help of other than government in order to address those issues. So insulin therapy being the essential component of type 1 diabetes management, this should be accessible to each and every type 1 diabetes patient. Now, talking about the various gaps which we found while managing type 1 diabetes in low resource settings, let us look into the various strategies which can address these challenges. So one important is when you have a community engagement based diabetes care programs. So that can be very effective when you have community insulin therapy programs, where you have a local distribution centers which can provide affordable insulins. You have a peer support groups which can definitely help the families as well as children cope up with the psychological aspect of diabetes. Diabetes education workshop. Now here you need a large force, men force, where probably you have to actually engage lots of NGOs and various other healthcare workers and try to train them in order to achieve this goal. And then obviously local healthcare worker training. That again leads to increased capacity building. That means you need to have not only the workforce behind it, probably you will also need the financial assistance as well. So you have to strengthen the diabetes healthcare infrastructure by training the healthcare professionals. This is extremely important. I think there is a lack of education as far as healthcare provider is concerned as well. Everyone cannot manage type 1 diabetes very well. So here also we need specialized courses for them and to train them as well. You have to expand the diagnostic facilities across India, enhancing the supply chain for insulin, and then you have to, at the various programs the government runs, you have to integrate the type 1 diabetes program into those programs so that more reach is there. public-private partnership model could be a definite solution. This could be the one area which should be thought about and could be a definite solution. We have realized it with different PPP models which have been running across India, and we will give some examples of that. So these models, if they integrate with the government resources, then they can enhance the access to and quality of healthcare. Their partnership can offer the innovative solutions for overcoming the various challenges which we addressed, and this is the only way, I think so, probably majority of the challenges can be addressed in our settings. So these are the challenges even in implementing PPP strategies. One should understand it's not that easy to implement the public-private partnership strategy. It again has its own limitation. So you might be having limiting funding and resources, because that, if you don't have a proper conceptualization of the program and you don't have the funding for that, probably that will hinder the ability to launch and sustain the effective programs which is needed. Then the physical facilities might be provided. What about the workforce which is needed for that? So again, the capabilities has to be enhanced there as well. And then the third major problem in India in particular will be to engage these private sectors in imparting as a part of CSR or whatever way they can be included to take up this task, because they all will be having varying interests and priorities. So incorporating them, bringing them on table will be always a big issue. But along with that, even if you have it, then you need to have an effective governance and coordination, because without a clear leadership and a structured approach to collaboration, efforts can become fragmented and you not be able to achieve that desired outcome. So that is also important. So all the four criteria in order to have a successful implementation of PPP strategies need to be implemented. Now let's look into the various government initiatives for type 1 diabetes. One is the NDCP program, that is National Diabetes Control Program. Till now it was only addressing the type 2 diabetes patient. The integration of type 1 diabetes program into this particular program will definitely have a more comprehensive initiative and can address majority of the issues, particularly early detection part. And National Health Commission also plays a critical role in improving the healthcare services. So if you can integrate the diabetes support in this mission, then obviously we can achieve lot of objectives. And the Rashtriya Bal Swasthya Karikram, which focuses on child health, including the screening and management of non-communicable disease like type 1 diabetes, is running. It helps us to identify the high-risk population and provide the timely intervention, ensuring a healthier future generation. Now let's look into the example of some certain public-private partnership which have successfully worked. One was the Novo Nordisk Changing Diabetes in Children program, which offered the free insulin and diabetes education. And the paper by Sagu et al. In 2022 has highlighted that it demonstrated the PPP success here by providing free insulin, glucometers and education to about 35,000 children across 342 centers. Now, Eli Lilly Insulin Donation Program is another one which probably has worked well. Sanofi Diabetes Awareness Initiatives to educate the community on diabetes prevention and management has worked. And thereby, the government-private collaboration can definitely have its impact on proper implementation of strategies and better outcome. So I'll give you a few further models which have a success story. The one is the West Bengal type 1 diabetes model. The established was in 2017, where they created dedicated type 1 diabetes clinics under the National Health Commission, where they trained the healthcare providers in pediatric diabetes management, and then implemented the electronic patient registry to track the outcome and manage the supplies. And what that led to, there was a reduced mean HbA1c from 9.1 to 7.5%. So that again tells about the success of this model as well. So impact has been significant, with the mean HbA1c level lowered by more than 2%, and this was again presented by Mukhopadhyay et al. In 2021. Therefore, a sustainability of improved glycemic control can be achieved in type 1 diabetes patient with this model. Let's look at the Kerala PPP initiative. Now, Kochi Diabetes Care Model partners the government hospitals with private specialists, achieving almost a 40% reduction in ketoacidosis through their mobile clinic intervention. There is a standardized treatment protocol adopted across 150 primary healthcare centers, and there is a free insulin distribution. So basically, the program really works well if you can partner with the government. You have the successful PPP strategies working out here. Now, this is a Valam PSC model, community-based care in Mehsana, Gujarat here. And here again, there was an awareness program and outreach activities in the villages, training the workers for the healthcare, training workshops for the healthcare workers on diabetes management, also incorporate the telemedicine services. Again, the results have been very impressive with enhanced self-management skills among patients and a significant reduction in emergency admission for diabetes-related complications. So this is another model which has worked well. The last model I'm going to skip out is the Dream Trust model, which is there in Nagpur, where regular provision of insulin supplies to the underprivileged children with type 1 diabetes was done, where they provide the psychosocial support. They also help them in educational initiative. So, along with the educational scholarship. So, this project again had a successful model. It improved the patient's adherence and quality of life. So, all the models which I talked about has worked at certain length in different parts of India. And so, I thought about the PPP strategies probably will be one of the better way of countering the challenges which the type 1 diabetes patient face in our environment. Along with that, if you look at the technological innovation which will almost transform the diabetes care. So you have the mobile health application which can be helpful for this group of patients. Then you have the telemedicine platform and automatic insulin delivery. So basically, this technology is revolutionizing the type 1 diabetes management in India with innovations helping bridging the urban-rural divide, because with telemedicine you can reach anywhere and everywhere. So you can definitely incorporate that. The AI-powered glucose monitoring system with predictive analyticals enable early detection of glycemic variation, while simplified application make advanced care more accessible and resource limited. So basically the future lies here, where probably we have to use the technology and the AI powered various applications which will probably be able to address most of the issues. So simplified AI application running on the basic smartphones, they can provide the valuable decision support for patient and healthcare workers without specialist training. So this can overcome the problem which we had where there was a lack of specialists to provide care to the patients at rural facilities. Telemedicine, as I said, it is a crucial tool. We have all realized since COVID-19 pandemic that we have been able to address most of the patient by telemedicine. You can have a remote monitoring, you can have group education, and along with that, if you have mobile health units to augment these programs, then probably it will be definitely of great help and comparable clinical outcomes from physical meet as well. So, sustainable type 1 diabetes care requires integration into the broader health policy frameworks. So corporate schemes should incorporate the type 1 diabetes management into the comprehensive non-communicable diseases with dedicated funding allocation for pediatric diabetic initiative. Now this need to be implemented. Probably his government is working on it. It has different missions and different programs which are able to somehow deliver those results. But then insurance coverage for insulin and glucose monitoring devices should be expanded under Ayushman Bharat and other national health protection scheme, which is presently not available. So this is one area which should be of importance and should be, the government should be taking a serious note of it. Now you have to build a skilled healthcare workers in order to have an effective and sustainable management. So that is also important. Community and engagement, as I said, more important that you have ASA workers, you have community workers. Now educating them into this field is also important. So if you can educate them with some incentives, probably they will be better tuned up to address most of the issues because they are able to approach maximally to majority of the population. So school-based screening and awareness programs can facilitate early diagnosis among children, because this again is lacking in our school programs. So this is one area which should be taken with seriousness, and more schools should be kept brought into the ambit of such programs, and thereby at least it can help us in majority of the cases. So the path forward, friends, requires coordinated actions across policy development, healthcare capacity building, technological integration, and community engagement. With sustained commitment from all stakeholders, we can definitely ensure that every child with type 1 diabetes receive comprehensive care regardless of their socioeconomic background or geographical location. Thank you.